Hi, my name's Anita. I'm here to introduce you to shock. Do you know what shock is? Would you know how to tell if someone was in shock? Did you know that shock can actually become a life-threatening situation? According to eMedHealth and Glenn Bauman of the Anderson County EMS, shock is a life-threatening condition that occurs when the body organs are not getting enough blood flow. And this is caused by a rapid release of adrenaline. Like when you have a fight or flight response, like when you get scared or you think the boogeyman's after you, and you get really scared and your heart rate goes up really fast, your respiratory rate increases, and you get ready to run or fight back. And that's an adrenaline release. When your body goes into shock, your adrenaline is released to help support all the rest of the body's systems. And once that body adrenaline is used up, then the body has no place else to go, and that becomes a true dangerous point of shock and life-threatening and can only be resolved in a hospital. The types of shock there are 4 major types of shock that they describe now, and it's cardiogenic, and cardiogenic shock is related to heart problems. A heart attack, blood loss, injury to the chest are some causes of what cardiogenic shock is. Hypovolemic shock is inadequate water in the body, and it's a loss of volume. It can be from like having the flu where you're sick a lot, having a lot of diarrhea, you get really, really dehydrated, you lose the volume, the body doesn't have the volume to pump the blood, and it can become a life-threatening situation. Anaphylactic shock is also called an allergic reaction. You know, people who are allergic to bee stings and they have to carry the EpiPens. If you run across somebody that is having an anaphylactic shock reaction from something that they're allergic to and they have one of the pens, you're allowed to be able to give it to them, so that will help them until an emergency personnel can arrive. Neurogenic shock is caused by damage to the nervous system, usually brain and spinal cord injuries. And what happens there is it causes in the brain the stop of involuntary and voluntary muscles in the body, and blood flow. Your blood vessels have muscles also, and they stop working. The symptoms of shock, if someone is going into shock, they may be anxious, agitated, or really restless. They may have bluish lips. Their fingernails may be a bluish color. They may complain of chest pain. They may have some confusion. They may be dizzy or lightheaded. They may even faint. Their skin color may be pale, cool, and clammy. They may be profusely sweating. Their skin may be really moist. They may have shallow breathing, or they may be totally unconscious. Children can also have shock too. According to Glenn Bauman, the EMT paramedic at Anderson County EMS, children are harder to tell when they go into shock until they crash, until their body uses up all their adrenaline, because they compensate for that really well. And usually when a child is in shock, they'll act unnormally normal. They'll just seem to be going along normal, and then they'll just drop, and then they have to go to the hospital. To treat shock in a first aid and treatment, the very first thing you want to do if you see anybody you think is in shock is you want to call 911. Secondly, you want to check on the person's airway and make sure that they're breathing. Even if they are breathing, you still want to frequently check that to make sure that they're continuing breathing. If the person has no head, neck, or back injury, you want to place them laying flat on their back and elevate their feet at least 12 inches. And according to Medline Plus, they're even recommending higher than that, the feet up above the hips, if they can tolerate that without any pain. And then you want to give any first aid to any wounds or injuries or broken bones that you can until further help arrives. Fifthly, you want to keep the person warm and comfortable and loosen any tight clothing that they may have on. 6, don't give them anything to eat or drink until EMS arrives in case they have to do further extensive treatment at the hospital. And 7thly, you just want to stay with that person and help keep them calm and maintained until EMS arrives. In conclusion, we've discussed that shock is a life-threatening condition that happens when the body organs are not getting enough blood flow and uses up all the body stores of adrenaline. The different types of shock were cardiogenic, hypovolemic, anaphylactic, and neurogenic. Some of the symptoms, again, of shock is they may be anxious, confused, have bluish lips or nails, chest pain, dizziness or faintness. Their skin may be pale, clammy. They may have profuse sweating. They may have shallow breathing, or they may be unconscious. And don't forget that children, too, can go into shock. And if the most common sign for them is they'll act abnormally normal before they crash. Remember to call 911. Keep a frequent check on the person's breathing. Place them on their back. Elevate their feet at least 12 inches if there's no back or neck injury. Keep the person warm and loosen their tight clothing. Don't give anything to eat or drink and stay with them until EMS can arrive. Thank you.